Did you know that 30% of people with rheumatoid arthritis also have Sjogren's syndrome? April is Sjogren's Awareness Month, and in honor of this event, today I'm talking to Cristina Montoya, my friend who's also known as the Arthritis Dietitian and who advocates for Sjogren's. Welcome, Cristina.
Thank you, Lena, for having me again. It's always a pleasure.
It's always fun when we get together.
Yes.
Let's jump right in and say, tell us, what is Sjogren's syndrome?
Well, let's just start from there and clarify that Sjogren's is no longer considered a syndrome. So let me explain that. So a syndrome is a group of symptoms that usually occur together and may characterize a disease, right? So they may say, but the Sjogren's book, which is an excellent resource from the Sjogren's Foundation, they actually recommended to drop the syndrome from Sjogren's and call it Sjogren's disease, because Sjogren's meets the criteria of a disease, which is well-defined symptoms. There are alterations of a specific organs and specific causes, which usually falls under the autoimmune causes that are multiple. So in terms of the disease itself, I like the definition of the outcomes measures in rheumatology. So they typically evaluate the criteria for clinical trials. So they do have a Sjogren's working group, and I've been participating in it. And they define Sjogren's as a systemic autoimmune disease that affects the entire body. And I like this definition because typically Sjogren's is defined as Zika syndrome. So Sjogren's is a dry disease. And so here they immediately say, no, it's a systemic autoimmune disease that affects the entire body. And yes, the major symptoms that you might see is the extensive dryness, not only from our eyes and mouth, but also your skin, vagina, everywhere. Other serious complications include profound fatigue, chronic pain, and major organ involvement like neurological, gastrointestinal. They can also there's an increased risk of developing lymphoma when you have Sjogren's. So again, this is a woman's disease, 9 out of 10 patients, right, are women, and the average diagnosis age is around 40, but it can affect anyone, really, from children to men. So, yeah.
Okay, well, I learned something new, and it's actually through knowing Cristina that I discovered, because I'd always heard about Sjogren's as being affected your dry eyes and mouth, and that was the end of the story. But it's through Cristina I've known that it has a lot more impact, including on your digestive tract, which we'll talk about that later. But let's talk about first your personal experience with this disease. You've had it since you were a child. So you were certainly not 40 when you got it, sounds like. What were some of the symptoms that something was wrong?
I recall feeling constantly sick to my stomach, even since I was 5, like my boy's age. I was always like in the bathroom somehow, like with diarrhea or constipation, always had stomach pain, nausea, vomiting out of nowhere. And my mom would take me to the doctor. There's nothing wrong with you. Then by the time I was 8, I started to get swelling of my salivary glands, the parotid glands that are like located right under our ears. And they were like swelling constantly. And all I got was, oh, you just have a case of mumps with a virus. Okay, fine. Yeah, I'm a child. Mumps is common in Colombia, and no, it kept happening almost every month. Apparently, I was having mumps every month. So I was loaded with antibiotics at that time and ibuprofen. And every time I started the ibuprofen, the swelling went down. So now, hindsight. So I later on, then I started having the dry eyes when now that I recall is that I just don't remember crying. I didn't have tears. I was having difficulty eating. I couldn't eat dry foods. In Colombia, we typically eat soups with our food, and there's like fresh fruits like papaya, mango. So I didn't really realize how dry I was because I was always eating those like kind of very high water content foods. And then my mom tells me that I used to get tired very easily. I couldn't keep up with my peers and I was always falling. I was on the floor. I was falling. And those are signs that then eventually, when I was diagnosed with rheumatoid arthritis at 21, then the doctor, a young doctor, said, put all the puzzle together and said, oh, by the way, you also have Sjogren's syndrome, right? And period.
Nothing else.
Nothing else.
Yeah, I know. Yeah, because we're not going to tell you what it means, but never mind.
Yeah, never mind. I obviously my rheumatoid arthritis. It was also serious. It was considered moderate to severe. So naturally, the doctors will focus on the rheumatoid arthritis to prevent damage. I was very young. I was still going to college. I was working. So yeah, definitely rheumatoid arthritis disrupted my life at that time. And since they dismissed Sjogren's, I said, okay, you can go on. But it's still, I continue with digestive issues. I just can't remember the day I didn't have them. And because I didn't know what I was eating, everything made me sick. It led me to develop an eating disorder.
Makes sense.
And it was difficult. I lost a lot of weight. And then when I was that, and then when the rheumatoid arthritis became really aggressive, I decided, hey, I'm not going to starve myself. I need the energy. I need to move. So then that kind of corrected itself, that eating disorder.
So you recently shared a story on Instagram that it felt like really profound reading it about being the girl that doesn't cry.
Mm-hmm.
And the connection to, I think it was a soap opera. Could you share that, please?
Yeah, it was the soap opera that we used to watch in Colombia was called Pakita Gallego, and Pakita Gallego couldn't cry. There was some sort of spell that she just prevented herself from crying, and then someone told her, you won't be happy until you start crying. And I didn't really understand that. So one day I needed to be disciplined as a child, and my aunt disciplined me and she spanked me, and I didn't cry. And it's like, hey, Pakita. And it's like, I'm not Pakita. Just cry. And it's like, I can't. And I just started laughing and so she's back me again. And it's like, oh my God. And then since then, I always recall that my aunt calling me Pakita Gallego from when I was 8 or 9 years old. And now I realize when this person told Pakita that you wouldn't be happy until you can cry. Well, with her, she fell in love and she had all these feelings. But for me, is that I understood that there was something wrong with me, that Sjogren's was causing the problem. And so that's what it was so difficult, because my mom went to so many different practitioners, conventional, non-conventional, shamans. I cannot tell you how many people I saw.
Yeah, well, I share that experience when I grew up with juvenile idiopathic arthritis, where it was a time when medicine really didn't have anything to treat it, so you go everywhere in the hope that something will reduce it. Like, I get that. It must have been hard for our mothers to go through that and try to help their kids and not be able to, I think. So, can you share some other highlights of your Sjogren's story?
So from my Sjogren's story, and even though I had it for 30 years, right, I started to connect some dots. So back in 2008, I was diagnosed with fibromyalgia. And that's what we understand, that it's a generalized pain, and it's usually associated with rheumatic diseases. But I was feeling mostly like the nerve pain, the neuropathic pain, but it was still classified as fibromyalgia. And for many years, it was very intense. Even when I got pregnant, it was intensified, like, I don't know, 1,000 times. I just recently, can you believe that? Maybe a year ago, I learned that Sjogren's actually has some, excuse me, neurological manifestations that can cause neuropathy, the small fiber neuropathy.
Wow.
And that it was most likely that that neuropathy was not really associated to fibromyalgia, that in fact, I may have never had fibromyalgia. It was the neuropathy all along. And by the way I treated my neuropathy, it was, they usually have medications, like Lyrica, that type of thing. But the one thing that really worked for me is medical cannabis, and I've always been open about it. And so that really helped with my neuropathy. However, because along those neurological manifestations, now we are also learning that Sjogren's is considered the second most common cause of dysautonomia. And for those who don't know what dysautonomia is, it's just an umbrella term that describes the malfunction of the autonomic nervous system. So you know how we have the central nervous system right in the brain, and the autonomic nervous system is like just from the spine and everywhere, and the peripheral. So in this system is so vital, right? Because it controls blood pressure, it controls your digestion, like respiration, gastric motility, even the saliva and tear flow. So for many years, we were told, oh, you have the lymphocytic infiltration, and that's why you have dry mouth and dry eyes. But now that's only 50% of the story. People with Sjogren's may have maybe 50% of the function, like a functional salivary gland, and still not producing enough saliva. So that is leaning, like the research is to say, hey, there's also malfunction in the connection of the neurological nervous system to the saliva and the tears to secrete saliva and tears.
Right, so it's not so much a symptom as a cause, is what you're saying.
Exactly. So the neurological manifestations are also maybe causing the symptoms. So instead of, I always said to patients, when you go to the rheumatologist or a physician, they're usually going to say, hey, you have Sjogren's. Yeah, you have dry eyes and dry mouth, period. Right? Or just go use some eye drops and mouth spray. Then I said to patients, that you continue with your symptoms. Are you feeling faint, like feeling faint or dizzy when you're standing? Are you having like your heart is racing, like those palpitations when you're standing? Are you having gastric motility issues, like you're feeling like you're always running to the bathroom, or just extremely constipated despite having a healthy diet and lots of hydration? So those are also symptoms that should trigger this healthcare practitioner to say that it's just not dry eyes and dry mouth, that there's something else causing it.
So I'm going to sidetrack from our list of questions, because why not? Do you think most rheumatologists know this information?
Sadly, no, because I've seen several rheumatologists, you see, over the years, for 20 years. And I only met one rheumatologist who was in Colombia. He actually wrote a book. Oh, I'm going to get it here. He wrote this book, and for anyone who speaks Spanish, it's a very good resource. So it's Síndrome de Sjogren's, and he was my rheumatologist, and I learned from him that Sjogren's is not just a nuisance dryness disease. But as soon as I met him, I came to Canada, and then I didn't know anything. But no, I have seen a rheumatologist trying their best to address mostly the dryness. And I've been I've been educating my rheumatologist coach. She's amazing and very open to learn about Sjogren's. She even has attended some of my webinars, and because of that, she has also educated older patients. And one thing that I appreciate from her is that she'll send me to any of the specialists that I said. So she had sent me, I have requested a neurologist, a gastroenterologist, ophthalmologist, all the ologists really.
Yeah. So is a rheumatologist the person you should see if you have Sjogren's, or is it another ologist?
That's such a good question, and I'm starting to really question that too, because rheumatologists generally say, well, you don't have joint or muscle pain or inflammation, there's nothing I can do.
Mm-hmm.
And I can give you, this is an excellent example. I recently talked to a patient who had all these symptoms, they all seem to be Sjogren's. This person was diagnosed by the neurologist, and the reason why she consulted was because of the neuropathy and the fatigue.
Mm-hmm.
Didn't consult because she had dry eyes and dry mouth.
Mm-hmm.
The neurologist said, "Yeah, you have Sjogren's. Oh, that makes sense." Okay. And after that, she went to the rheumatologist and say, "Well, but there's no other symptoms I can treat." So to be honest, I think that needs to be redefined. Who should be like leading the way?
And it sounds a little bit like that, depending on the person, is like it's almost more of a team approach, because there's the neurological aspect, there's the oral health aspect, there's the like there's gastrointestinal. So it sounds like almost like, yes, it needs a home, that's somebody who leads this. But it sounds like if you have a diagnosis of Sjogren's, you should, I guess, would you advise people to then ask their doctor for referrals to, say, gastro? Let's say your rheumatologist diagnoses it. Should someone then ask for a referral to a gastroenterologist, to a neurologist, etc., just to kind of make sure that everybody's working together there?
That's the ideal, and I think that's where I see the difference with rheumatoid arthritis. Because with rheumatoid arthritis, I feel the rheumatologist is there, right? It's their realm. They know what to do, what options to explore. But I think they fall short when it comes to Sjogren's, and that they should be more. I think probably the rheumatologist can become the patient navigator.
Mm-hmm.
Where that's the core, that's where traditionally the patients are being treated, because some patients, up to 30% of patients, or even more, if that 30 to 60%, we're still learning, they have systemic manifestations. So some of them, they may require immunosuppressants, so hence the treatment by a rheumatologist. And I firmly believe that most of my joint and muscle pain is fully controlled by the medications I take for rheumatoid arthritis. So I do feel it for those patients who are solely diagnosed with Sjogren's.
Would you say, and again, I have a list of questions and I'm going off script. Would you say, I know you're on a medication that at least controls mostly your RA, is that correct? Has that made an impact on your Sjogren's in a positive way?
I'll say yes, mostly when it comes to the pain, joint and fatigue. I'd say that also, fatigue was a big one. It's making an impact on my brain fog, but they are not the medications. Awesome. But they are not the medications that are being studied for the big clinical trials that are undergoing right now. So I feel that whether it's that my body is adapting, or is the medications are also working somehow. But yes, I do say that they help with some of the systemic manifestations.
So are you in a clinical trial right now for Sjogren's?
No, but that's the thing. I cannot participate in a clinical trial because I'm already taking immunosuppressant and a biologic. Okay. And they typically, how they do not include patients with other comorbidities, which is also kind of silly because how would we want to understand the complexities of these diseases? But anyway, the idea is they have really strict guidelines. So if you are in the U.S., I know there's currently recruiting for trials, clinical trials. So if you go on the Sjogren's Foundation and you search for clinical trials, they will guide you where to go and even sign up for one of these clinical trials.
Okay, that's great information. So you have shared some of the impact of Sjogren's, but what is, I guess, Sjogren's has many faces, sounds like. What are some of the impacts? Like the obvious one, I guess, if you know about the dry mouth issue, then it can impact your oral health. But what are some of the impacts of the disease? Like, what does it do to your life?
I did to my life. Sometimes when I feel Sjogren's is attacking me, it comes with fatigue, and I can differentiate between the fatigue from Sjogren's and rheumatoid arthritis. And
that makes sense.
I can definitely see that, because when it's Sjogren's related, it's extreme fatigue, and I know many of you can relate to that. But it comes along with more like the dryness becomes unbearable. My eyes get swollen, like I got punched, like really, like I was like in a boxing match or something. And I, again, because my target organ, I will say, is my digestive system. It's just a mess. I'm having difficulty swallowing. That's another thing that I'm noticing lately, is that foods are truly getting stuck in my esophagus, and I can see that it's not associated with the dryness. Or maybe partly because there's also a gland secreting lubrication in your esophagus. But remember, I mentioned that there's it can affect the motility of the entire gastrointestinal tract. I have to say that this one is scaring me, to be honest with you.
Yeah, understandable. Who would you see for that? Is that a gastroenterologist who would?
Yes. So, and here's the thing that comes with having Sjogren's. So typically a patient with Sjogren's will experience all these digestive issues, right? So they have the dry mouth, they have difficulty swallowing, or they have the heartburn. So typically they will do an endoscopy, or they will do a colonoscopy to rule out all their structural damage, like inflammatory bowel diseases, Crohn's, cancer, polyps, or all the other things. And most patients actually find, it's fine, it's clear, we don't see any structural damage to the gastrointestinal tract. But then they just stop there again. They don't maybe go deeper into, okay, are there any motility issues? I feel like a patient with Sjogren's, they have these symptoms, they run the test that can show that there is motility issues.
And I think that's let's just explain for anyone who doesn't know, what does a motility issue mean? Like, what does that look like?
Okay, so what that looks like is that, as I mentioned, there was the autonomous nervous system is also responsible for maintaining those waves, right, that push the food down all the way from the gum to bum. So when there is this disconnect between the nerves and the muscles that are also innerve all the gastrointestinal system, so there is a disconnect. So it's supposed to go down like this, very like rhythmically, but then there's a dysnergia, or there's disconnection. It goes like, it's up, stops. So what that causes, it can create a lot of issues. It's starting from the esophagus, because then you're having difficulty swallowing, you're having risk of choking. It is very scary. Then you start to restrict yourself many foods because you cannot eat. Let's say, I'll give you an example. Celery is super healthy, but it's also a choking hazard. Peanut butter, go natural, is a choking hazard. So then you start to really be very careful with the foods that you eat. let's say that food was able to pass down your esophagus and it reached the stomach, hooray. Round in the stomach, again, the gastrointestinal tract has to continuously keep moving, right? You always keep moving and passing that food. Now the food content may stay there in your stomach for a long time. So you feel fuller, then you know that that's an issue, may cause like heartburn. And then eventually, if the colon is not moving rhythmically all the way down, it's gonna cause constipation or diarrhea, right? Because there's like the rhythmic is not functioning. So all these issues they can cause like chronic constipation, and this is the type of chronic constipation that cannot be resolved with fiber and fluids or laxatives. You need something else to get the bowel moving.
Yeah, and which we will get to shortly, but I also wanted to talk to a little bit about some of the other issues around oral health, because I think when you hear dryness, and this may also be a way to find out whether you have Sjogren's, that if you have dry mouth, how does that affect your teeth and gums?
Yeah, that's an excellent question. So we typically, or a healthy person, really takes saliva for granted.
Yeah.
Typically, a healthy individual will produce up to like 1 liter or between like 500 milliliters or half a liter to 1.5 liters of saliva a day, depending on how the stimulation is. A patient with Sjogren may only produce up to 150 milliliters, or even not, it's not even half a cup, or even maybe a cup of fluid or saliva. So that has serious implications because saliva is not only there to provide lubrication and also contains important components that are antimicrobial. So it's going to help you to fight bacteria. Sorry, I have all these ants here. Sorry. To fight bacteria. It also contains small amounts of salivary enzymes, so digestive enzymes that helps to break down initially all the starches, right? Like the starch and also fat. So if there is not enough saliva, so the food is not going to have enough like content, like a surface area to really lubricate. Oh, the saliva is not going to lubricate all the food that you're eating. So the digestive issues kind of starts there. But it also, because you don't have saliva, so there's not that ability to clear your mouth. So all that food is getting stuck in your teeth. And that is like it helps to grow bacteria. It causes periodontal disease. But what happens in Sjogren's too is that not only the bacteria is there, but there is a recession, like how we tend to, our gums tends to reside and get kind of very thin. Our gums, so it starts to lose support from our teeth. So that's when we start having also lots of cavities, and the cavities from Sjogren's, and that maybe is a clue that might be Sjogren's, and it doesn't happen on top of the teeth, they happen around the gum line. So that's very characteristic of people with Sjogren.
Okay, so definitely part of your medical team should involve a dentist who hopefully knows something about Sjogren's.
Yeah, that's also a tricky part.
Okay.
The Sjogren's, or at minimal, understand dry mouth, and you have to be very careful, like with a dental hygienist, that they can go crazy or like scraping your teeth, and that's going to destroy their enamel. So be very careful who you choose.
Good to know. Good tip. So as someone who lives with Sjogren's, what are some of the things you do to manage on a day-to-day basis?
It's a whole routine, to be honest. You wake up in the morning, so from the morning, I initially brush my teeth, first of all, and then I have to go immediately drink a glass of water because they just feel so dry. Then I had to look after my eyes, so I typically do like a cleanse of my eyes. I use like eyelid wipes, usually Sustain or Cancer Vision has some of those. Take my anti-inflammatory eye drops, boom, wait 15 minutes, take my autologous serum drops, get there, make sure that my eyes are nice and moistened. Then for my mouth, I just keep like really stay hydrated. Make sure that I have my mouth sprays like around me, has silent melts. So those are like some these lozenges that you kind of stick in your tongue, right? And then it releases xylitol and stimulates saliva production. So those are like typically like the skin must be hydrated, and I usually like to have something that I got from the US. It's like skin lotion made of goat milk. So there's like really no preservatives there. Keeping my make sure like my lips are very nice and hydrated with a lip balm. Um, and then like I carry on with all the medications and the vitamins. Um, my foods like typically I try to it has to be soft to be honest. Sometimes when my Sjogrens is acting up, I resort to soups and smoothies or even nutritional supplements. So I stay hydrated. And when the fatigue hits, try to get some movement because the movement to me is the best way to fight fatigue and clear my mind, and find some time for rest. I think I learned that from you. Even if it's just 15 minutes of not doing nothing, allow yourself
Yeah.
that right to unwind.
Well, and I think that's a common thing for RA, for Sjogren's, for many other chronic illnesses. Like give yourself permission to rest and take like frequent moments. If you have a busy day, take those 15 minutes, 10 minutes, whatever, to just kind of recharge is so important. But isn't in the modern world, there isn't a lot of time for that. So it's kind of it's a real act of personal revolution almost to say, no, I'm going to rest. I also wanted to talk about some of the latest news, like you're both very tapped into Sjogren's literature and community, and you recently presented at a national, a virtual Sjogren's conference. What are some of the latest news that you can share?
But I think I really share like probably the main two things that are happening. It's one, the concurrent clinical trials happening with Sjogren, and that's mostly led in the US. But also, I forgot to mention there's a Sjogren Ireland and Sjogren Europe, and I think they're running probably the first research that is mostly focused on neurological manifestations. So that was really, I'm really looking forward to see those results because they get a lot of people involved in that research. And there's also an ongoing research in collaboration like the Sjogren's Foundation and Dysautonomia International, where they're trying to really unveil what is really the root cause of this dysautonomia as well. So many people are saying. So I will say that I know living with Sjogren's is frustrating, especially for someone who's newly diagnosed. You don't see many options. Doctors keep telling you it's just dry eyes and dry mouth. But compared to what I was told 20 years ago, I think we are taking small steps. We are moving, but I think we are moving forward. At least we're talking about it. Like I've seen physicians talking about it. I've seen other healthcare providers talking about it. So I have hope.
Yeah, no, and I think that the awareness and that there's research into these more recently discovered, I guess, origin and symptom and so on of Sjogren. I think that's a really big thing because there's this wonderful expression in the planning world, like people who do like paper planners and things, that says, if you measure it, you can manage it. And we're finally measuring something beyond dry eyes and dry mouth, which is a good sign. So you also you talk a lot about managing the condition with nutrition. What are some of the things that you feel is important in that aspect?
Well, in terms of if you go for autoimmune diseases in general, we know that there's not a specific diet, but I feel my main focus is because it's my gut health. And when it comes to Sjogren's, patients who have gastrointestinal manifestations, that's where I really feel I can contribute to improve their symptoms. But generally, for patients with Sjogren's, I will suggest to always choose foods that are easy to chew and swallow, that they're easy to prepare, that you follow the anti-inflammatory eating guidelines the best that you can. But let's say when it comes to vegetables and some fruits, you might actually want to avoid the ones that are really crisp, right? Like kale or those sort of vegetables. Go for those that are maybe softer, just like just a regular lettuce or cooked vegetables, which is something that might be different from other diseases. Like if I were to have rheumatoid arthritis, I'd probably enjoy a nice, crisp, fresh green leafy salad. That's not the case with patients with Sjogren's. They need to be more mindful of the food so the stomach doesn't have to work as hard. Because remember, we don't have this saliva that help us to chew the food very well. So chances are that some of the foods are going intact into the stomach. So the stomach has to work harder. So I try to go more like as a gentle digestive approach when it comes to eating. Always when it comes to swallowing, and typically you can see me here sipping on water. But if you're having difficulty swallowing, water is not the best thing to do when you're eating. I suggest to have something is a little bit thicker. Think of like a soy milk or oat milk, even regular milk if you tolerate it, because it will allow to mix up more with the food and go down. The water bypasses the food and it actually it can cause choking.
Yeah, and I think, like obviously you're a dietitian, so you know more about food than most. Do you think a dietitian needs to know about Sjogren's in order to help you, or can you use a dietitian in other ways to kind of to live with Sjogren and having a better diet and so on that might support you?
Yes, I feel, and thank you for asking that, because recently a patient told me that a dietitian is only for fat people.
Sorry.
That patient was told that. A patient
Oh
with
my
Sjogren
God.
asked for a referral to a dietitian because she was having all these gut issues, and the doctor just flat out say that a dietitian is for fat people only.
Okay.
So I went back and said, okay, wait a minute. We know if we don't have really an effective treatment for Sjogren's, we cannot expect a dietitian to give you a detailed diet plan to cure your Sjogren's, because we don't even have effective treatments. We still understand it. But how can a dietitian help? And that comment actually helped me reflect on that. So we can provide guidance on modifying your diet to ease discomfort related to dry mouth, chewing and swallowing difficulties, gastroesophageal reflux disorder, constipation, and other gastrointestinal symptoms. And also you can improve your nutritional status to prevent unexplained weight loss. That surprisingly happens a lot in Sjogren's. There's a lot of weight loss and muscle loss, and also deficiency in essential nutrients. We can also work together and develop a more personalized meal plan, not just the general that you get out of the internet. You can also, dietitians can help you reduce the risk of potential interactions between drugs and medications and supplements. They can help to also identify maybe some helpful supplements that can help to optimize your overall health and gut health, but also they can help you identify what is harmful for you, because not everything out there is safe. Supporting you, I think we do a lot of counseling on behavior change, when we can support you to make those healthy lifestyle changes one step at a time. And I think also we can help as a patient navigator by collaborating with other healthcare team members to enhance the clinical outcomes, to educate them and what Sjogren is, and also help in symptom management. I feel that you are working with a dietitian who can support you in all the things that I say. But if a dietitian or any nutritional professional comes with a cure or a magical protocol, I would just stay away from it because we still don't have it.
Yeah, yeah, no, I agree. And I also think like you want to make sure that the dietitian you see can kind of think outside the box, or perhaps has experience in teaching or in working with people who have had swallowing issues for other reasons, because like there's overlap, right? Like I had a dietitian once that came in. Well, I've seen a couple of dietitians, and one was absolutely wonderful and one was useless. In the sense, I came in and I talked about, like, she asked about vegetables, and I said, well, I do a lot of green smoothies. And she started talking about how it was much better to eat the raw vegetable. And I do smoothies partly because I sort of crave them, but also because I have RA in my jaw joints, and they're pretty wrecked by it. So when I chew hard, crunchy things, it hurts. Mm-hmm. So I'm kind of like, well, yes, I would like to be able to eat a nice crunchy salad, but all that chewing just destroys my joints. Like my jaws are just wrecked afterwards. So I think it's important that if somebody's really rigid about how you should eat certain things, instead of saying, yeah, for instance, a crunchy salad is the ideal. But if you then boil or you steam your vegetables, or you eat them in a smoothie, that's the next best thing. Like, if you can't do this, don't just stay there. Give me an alternative. And I think whatever health professional you see, one of my marks of a good one is somebody who can go, all right, you can't do this, let's find another way around it, right?
And that's the way to go, because not everyone have like the same resources at home, right? So something that really bothers me when someone talks about the anti-inflammatory diet, and you gotta meet like these guidelines and have certain foods, and I say, well, food prices in Canada are ridiculous right now.
Yes.
Like there's just it's just I can't even tell. So we really need to be very mindful of what we're going to put in our mouths. And we might have to rely a little bit more on the canned foods, right? But we want to make sure that to rinse them. And that's the truth. Like, we want to give you alternatives, but because this whole buzz of anti-inflammatory diet it's getting so strong, this movement, and there's encouraging people to have all these amounts of vegetables. And I agree, someone with Sjogren's combined with rheumatoid arthritis, having the joint pain, the chewing pain, the chewing difficulty swallowing, and the dryness, like, come on, no, that's not going to work. All the whole grains with extra seeds and all that, it might not be the greatest thing for you.
Well, and then, like, for me, I'm allergic to nuts. So there you go. I can't have the nuts either, right? And finding somebody who just sits and say, well, you should have this. And I'm like, but I can't. So what are my options, right? And that's kind of my test. If I go in and my first appointment is all about, you should do this, and they don't know how to take a step after meeting a barrier, then I'm like, okay. It doesn't mean that you should give up on finding a dietitian. Perhaps just that you need another one. So keep looking.
Keep looking.
Yeah. So as we've discussed, you also live with rheumatoid arthritis. How do you balance these two conditions? And are there things that sort of make one better but the other one worse?
Oh, yeah. I feel somehow I found balance over the years to try to identify. And I think the example I gave you about what to eat, in terms of, I also have like jaw pain, and it's finding those alternatives. But what I think can do for one that worsens the other, I don't know. I can't really tell. I actually feel that what I do for one actually helps the other.
Okay, that's important.
The one thing that I don't see that any of the medication that I take for rheumatoid arthritis helps me with my dryness, it does not. I do have to find alternatives to that. And I know that so many people get frustrated as it's not just dryness, but unfortunately it does cause, like, disrupt your quality of life. And you have to change the way you do things. It's annoying carrying up water everywhere, or you have to carry mouth sprays. It's like I actually have to carry a whole bag, a bag, a cosmetic bag, no, with makeup. No, I have mouthwash. I have like a toothpaste. I have a special like so all that we need to accommodate. But I will say that what you do for one can enhance or can benefit the other disease. That's what I find.
Yeah, and I think that tends to be followed through in other things. Like I have both RA and fibromyalgia. And one of the best things I did for my fibromyalgia was getting my RA under control. So I think that has some overlap to other conditions too. And someone who had just been diagnosed with Sjogren's, what's the first thing you would recommend they do?
That's the first thing. First of all, I will just go to the more reputable sources of information, which for now I'll say the Sjogrens Foundation, the Sjogrens Society of Canada have good information. And if you are like in Europe, Sjogrens Europe, or the Asociación Española de Sjogrens, which is the Spanish foundation, I will start there before going on Google and say, oh, what is causing my dry mouth? Like, just start there. Then if you can find that one medical practitioner, like let it be your family doctor, rheumatologist, that can help you navigate and connect you with all the team members that I mentioned before. And also, even though it's not in your head, having mental health support is very important too. Excuse me. Other option is like, oh, I don't want to go. I'd rather read. This is a great resource by the Sjogrens Foundation, like Dr. Daniel Wallace. Like, there's lots of good information here that can get you at least started with the basics of Sjogren's. Another resource that I recommend is a Sjogren's Advocate. That's by a doctor. This Dr. Sarah Schaefer. She is also a medical doctor that has to retire because of Sjogren's. So so she became an advocate, a very, very strong advocate for Sjogren's. So this is where I will start. Okay. And also take one problem at a time, because as Sjogren's can affect everything, right? So you pick what is your hot topic. What is that is bothering you the most when it comes to Sjogren's? Is it the fatigue? Is it your digestive symptoms? Is it your dryness? What is it? So start from there, and then take another one at a time.
No, that's good advice, because information is important. Too much information is overwhelming. So one step at a time at your own pace, I think. And lastly, if people want to know more about Sjogren's and your work, where can they find you online?
Yeah, so I recently reactivated my website. It was kind of dead for like almost 2 years. So my website is arthritisdietitian.com. But I am running some webinars every couple of months on Sjogren's and gut care. So I had already run one on the IBS and Sjogren's and the low FODMAP diet. I also did one on digestive enzymes in March, and next month I will be doing one for Sjogren's in management of constipation in Sjogren's. And in July, which is like maybe a larger event, still kind of casual, I want to make it casual, it's a gut care event where I'm inviting 5 guests that are going to teach us how to manage different gut symptoms. So that will be on July 20th. So you visit my website, subscribe to my newsletter. I think that's where you're going to get the latest news. You can follow me at Instagram at Arthritis Dietitian, also TikTok. I'm trying that, Arthritis Dietitian, and the YouTube channel. I use it to kind of share the webinars that I do.
Excellent. Okay, and I will drop the YouTube channel and the website in the description box, so everyone can find you. And that's it for today. We could keep talking about this, but I think we'll save that for the future events. Thank you so much, Cristina. This was very educational.
You're very welcome. Thank you for having me again, Nina.
Anytime.